Okay. I've never done an assignment in front of a camera before. Makes it interesting. The unethical issue in healthcare I'd like to discuss today is the practice of ordering chest x-rays for no apparent ailment in the chest. I by no means have as much knowledge of the human body or education as the medical doctors that are ordering these, but it seems to me that some of these are not necessary. In clinic, I perform 10 to 20 chest x-rays daily. And it seems that 50% of these are for not ailments in the chest area. Many of them are for pre-op. Now, if you have a heart or lung disease, you definitely want to get a pre-op chest x-ray because it could show medical problems such as an enlarged heart or fluid around the lungs. But it does not help the surgeon or the anesthesiologist manage your care. Most of the time, a good and careful medical history and physical examination are all you need. Some would say, what's the difference? Why not just go ahead and have the chest x-ray? Because they feel no difference before or after. There's two types of radiation, ionizing radiation. There are natural and man-made. Natural background radiation has three components. Terrestrial radiation, which is from radioactive materials in the Earth's crust. Cosmic radiation, which is from the sun and beyond the solar system. And internal radiation from radioactive atoms, also known as radionuclides, that make up a small percentage of the body's tissue. That's the natural. Then you have man-made or artificial radiation. These include consumer products containing radioactive materials, such as many years ago, watches had radioactive materials in the face, air travel, nuclear fuel for generation of power, atmospheric fallout from nuclear weapons testing, nuclear power plant accidents as a consequence of natural disasters. The Fukushima disaster, I believe, not too many years ago, when a tsunami hit Japan, and medical radiation, which entails CT and X-rays and such. Now, why is that important? Because ionizing radiation is cumulative, meaning it does not go away, it just builds upon itself. And that being said, we do not know how many x-rays were done before the exam was taken, or how many x-rays or CT exams are going to be done afterwards. So we don't know how much ionizing radiation is going to cause biologic harm to the patient. Dr. Ann Packard with the Mayo Clinic in Rochester, Minnesota, said chest x-rays can be a valuable exam when ordered for the correct indications. However, there are several indications where chest x-rays offer no benefit and likely should not be performed to decrease radiation dose and cost. Now, Dr. Packard and also an assistant of hers, well, another doctor, Kristen Thomas, did a study. And what they did, they reviewed data from 718 pediatric chest x-ray exams ordered between 2008 and 2014 in the Mayo Clinic's inpatient, outpatient, and emergency room settings. The patient's age ranged from newborn to 17 years old. Of the 718 x-ray exams, 377 exams were ordered for chest pain. 98 indicated syncope, which is fainting, or pre-syncope. 21 indicated spells, a general feeling of being unwell or under distress. 37 indicated postural orthostatic hypotension, or POTS, and that's where your blood pressure drops suddenly whenever you rise from sitting or laying down. And 185 people indicated dizziness. 82 of the 718 exams were excluded due to congenital or other known heart disease and other causes. The researchers found that in approximately 88% of the 330 non-excluded patients who were presented with chest pain, the exam did not alter clinical treatment. So in other words, it was not necessary. None of the patients who underwent x-rays for indications including syncope, spells, POTS, or dizziness had any finding that affected treatment. 38 of the 330 non-excluded x-rays for chest pain were positive for pneumonia, bronchial inflammation, trauma, or other conditions. And now I'm going to butcher this name. Dr. Salameo, Salomao, Faintouch, at Harvard Medical School said the next step is to try to educate physicians in an attempt to reduce costs and radiation exposure. Now that's how it affects the healthcare professional, by allowing the rad tech to spend more time with other patients by not doing unnecessary exams.